Hi everybody, I'm Susan Collini and welcome to our Renaissance Center Age of Innocence Collini Laser Clinic, Princess J. Collini Roundtable. It is September of 2023 and this month is actually PCOS month, and you'll probably say, what is PCOS? PCOS is polycystic ovarian syndrome. So that's our discussion today, and we're not going to really touch base on all the medical implications about it. We'll touch base on how it presents itself and how we can address some of those issues being in our facility. So the very first thing is, what is it? It's a hormone imbalance, and it can cause excessive hair, which we call hirsutism, and it can cause, this is for women, I should have specified that, women. And
polycystic ovarian syndrome.
Right. So it also manifests with cysts in the ovaries. And before we get started any further, I want to introduce our team. Oh, good. Thank you. I feel like I'm shining over that. We have our new baby over here that's joined us. And we are in a different room than usual here at the clinic. So this is Ronnie on my far right, your left, and Derek, and our patient and nurse Ashley, and of course I'm Susan Collini. So one of the things that I think when we deal with PCOS here in our facility, patients usually come to us for addressing the excessive hair removal. And women can present themselves with a lot of facial hair, excessive hair anywhere on the body because of androgens. There's an excessive amount of androgens that are associated with this syndrome, and that's one of the things that drives every woman crazy. And probably, as Derek mentioned before, we spoke about acne and some other different things. So at this point, I want to have Derek start talking about what we can do with our lasers and actually mention our electrolysis that Suzanne, unfortunately, our electrolysis technician, Suzanne, couldn't be with us, and she could really speak a lot about her technique.
So with polycystic ovarian syndrome, a lot of the things that it drives are hormonal hair growth, like Susan said, extremely oily skin, and an overall general tone and texture issue with the skin. And anytime that something is pushing a hormonal thing like that, when it has to do with hair growth, you're going to see some acne that's also involved in that. So basically, someone does need to be diagnosed with this syndrome from their physician, and then all we are able to do is mask the symptoms of PCOS. So what we standardly do is we have a specialized treatment for hair removal for someone with PCOS, because it's not something that you do the standard 6 treatments and then you're finished. Unfortunately, for a lot of people suffering with this, it's more of a commitment to them. As long as the syndrome's active, they are going to have some active hair growth. So it's something that we price differently and that we handle differently when it comes to our standard dialed laser hair removal. The nice thing with Suzanne, as we had mentioned, when it comes to treating with electrolysis, is she can now treat hair of all colors. And if it's a small area and they don't necessarily want to get into the hair removal, she can treat the small areas as well that are getting a lot of growth. And also if it's white hair that's being driven by the hormones, because this does affect women of all ages. This isn't just a young woman thing, it's really does affect all people. So she can address all of those things that we can't with a standard laser hair removal. But when it comes to the skin issues that somebody with PCOS has, what we try to do is we try to control the oil production, because that's the thing that's complained about the most. So they're going to have a lot of breakthrough oily shine, and what people tend to do is, what do they want to do? They want to wash that oil off the skin, and then they tend to over-treat their skin, and then you actually end up producing more oil. So
Catch-22.
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 So some of the things that we like to do for PCOS is, number one, your at-home care. So we're going to get you on one of our medical grade Kalini MD salicylic washes. Salicylic acid draws oil out. It helps with the acne breakout. And then there's a little bit of glycolic in that as well to cleanse the follicles, because you're going to notice a lot of activity around that facial hair that will lead to almost something that looks like a razor burn. So we treat it with our medical washes. That's something that you're going to do on a regular basis at home. And then once we have you in a good condition with what you're doing at home, we could even do things like Ashley does a lot of salicylic acid chemical peels, which also slow down the sebum production in the skin. But one of the best things that we can do for you now, being that we do have this machine, is called the BBL, and it's their acne version of BBL. So what
we didn't describe this beautiful machine.
We didn't talk about the BBL. So yeah, this is our Cyton BBL, which stands for broadband light. So this is the most powerful machine on the market in the IPL realm, because most of the time you're going to read it as IPL or intense pulse light, but this is broadband light. So what I'm able to do with this machine, there are little slides, and you can see on the front of the machine that each slide allows me to target something very specific. So with the BBL, if I have someone that comes in to me that is concerned with the hair growth, oil, and acne, we can actually treat all things with this machine. And what we do is we go from blue light that is going to kill the bacteria that they're experiencing, and that P. acne bacteria imbalance. We're going to use a yellow light that's going to go in, and it's going to calm all of that inflammation that's associated with that hormonal growth and that hormonal acne. And then we're going to go into our infrared lights, and that is going to help soothe the skin. It's going to help with the post-inflammatory, that red pigmentation that you get once a pimple goes away. Sometimes that lasts even longer than the acne itself. So we could go in and really, on a medical level, because of the depths that this machine is capable of reaching, we can affect your really basal and deep layers of the skin to slow down that production that's associated of oil that's associated with PCOS, which helps you in turn with your acne and just not being able to wear makeup and having some textural differences of the skin with that extra oil production. But the main thing that we do, and you can see, we'll post a picture today, the main thing that we see is the pattern of hair growth in the face, like Susan said, that we do treat with our laser hair removal. And we do get clearance. We do get complete clearance. I have had complete clearance for somebody, but it is ongoing because this is something hormonal. So your body's always driving that growth.
And I think some of the patients that we've seen, the really severe patients, and there are different severities of PCOS. So you can see some very mild patient manifestation of hair growth, but you can see some really severe where women have full beards and they get ingrown hairs, which is another whole issue. So there are a lot of different things that we can do to help treat that and ease their suffering and whatever, but it's a commitment like anything else, but there are treatments for it. So don't think that you can't, you're stuck.
Yeah. And you're not alone. I mean,
you're not.
I would say probably, I'm going to go out on a limb and say 70% of the serious growth is it's like 1 in 10, I think, of the serious growth that we see is related to PCOS. So I have these women come in and they're almost embarrassed of the growth. This is what we do here. Like, we're here to treat. And it is a very, very common syndrome, and definitely can be alleviated with what we have to offer in the facility.
Perfect. So now I think we're going to go and do a little treatment.
So Ashley is not suffering from PCOS, but what I want to show is the ease of treatment when it comes to stepping into laser light. And this is basically, like I said, a broadband light. It's not actually puncturing a hole into the skin. It's dispersing light in the skin in different various areas and using different wavelengths of light to target things. So today, what we're going to do is show you what it would be like if you came in for a treatment to reduce the oil, bacteria, and coloration in the skin. So I'm going to flip my little baby on.
There we go. And in order to be prepared, we have to
have
protect
our
eye
glasses.
protections on. My poor
And
nose
don't
is
mind
like
my
that.
little, don't mind my hot little blinks.
We do have little,
Ashley's are right here.
there we go. Protect the patient too.
Yes.
Can you see this, Sarah, can you tell us if you can see Ashley, or should I get out of the way? Okay, I'm gonna move so that you can see her at home.
So again, I'm getting my blue slide because we want to target that bacteria, which P. acne bacteria is always present in the skin, and we're using light to help balance that out.
You look like Y2K.
These are my
Yeah.
these are my blinks, and what they do is they blink for you every single time the light flashes, because it is a very bright treatment. So Ash, we're just going to go along. I just want to show along the jawline what you're going to see here. And give your jawline a push.
Yes. Magically, it appears on camera.
Yes.
This is exciting. This is our new laser that we love.
Turn this way. So, little backstory. I've wanted one of these lasers for many, many years. They are some of the best lasers on the market. So I'm just cooling the skin a little bit. And what you'll see when we go in to target this, she's not in any discomfort. It's a relatively quick and easy treatment. Are you ready? Are you feeling anything?
No.
So she's getting multiple flashes of this blue light, and what that's doing is actually creating like a hydrogen peroxide under the skin, and when it does that oxygenation of the skin, it goes in and it kills that P. acne bacteria. So if you were someone who was suffering from the hair growth and the acne, this is going to help clear you up. So this is the first step that will go and clear that bacteria, like I said. And then your next step that you're going to do is you go in with your lighter slide. Tell me what's a different one.
And there are various shades of the next color when we get into yellow. So sometimes the machine does have a
The
little
skin
light of its
tone.
own
Yeah.
based on the skin tone.
Just stand by it on me. So now we would go in and individually treat any of the pigmentations in the skin from the acne lesions, which, like I said, that's called, you'll see PIH, that's called post-inflammatory hyperpigmentation, which could be ongoing and it can last for months. So as you see, I'm only treating a small part of Ashley's face just so you can see how the machine works. But you notice the ease of treatment. You also see how fast it is and that Ashley's not sitting here suffering.
Squirming.
So she would, in about probably a week, she'll start to see the clearance of the acne itself. She'll start seeing those pustules and papules reduce. And then over the next month or so, which is a normal skin cycle, she's going to see a quickening of that exfoliation in the skin and start to see a smoother texture and less of that post-inflammatory hyperpigmentation. And at the same time, we would be treating their hair growth as well. So they're going to see a reduction with each treatment of their hair growth. So it really can alleviate all the symptoms, basically, of a PCOS that we can in our realm at least.
Right. Perfect. Thanks, Derek.
Of course.
So back to a few other things. So you just saw what we can do acne-wise and to even up the skin tones, but you might want to just go over very quickly some of the hair removal laser techniques,
Sure.
because that's a big issue that
Sure.
most women come in
So if you hadn't watched some of our other videos on hair removal and you're not 100% sure how it works, hair growth has 3 phases: anagen, catagen, telogen. When you're treating for hair removal, at least the diode laser hair removal that we do, which is a light-based hair removal, you want to treat that hair in the active growth phases. So that requires 6 treatments. Some people say, you just want me to come back 6 times. We love to see you, but that's not the case. You're only in a 20% active growth phase at any time. So that is the 6 treatments gives you beyond that 100%. Now what happens with PCOS, like we said, you have it ebbs and wanes basically of what your symptoms are. So if you have an issue and the ovaries are acting up at that time, it might drive some new growth and some more growth, and that's why I tell people, don't be disappointed if with PCOS the hair removal is ongoing, but we can absolutely treat all the symptoms, and Susan has created, a pricing of coming back on a regular basis to help you with that syndrome.
Right, and we do have 2 lasers now that do address a hair removal, so even if we had an abundance of patients,
typically
we can
actually 3, because we have electrolysis as well.
Well, the electrolysis is not a laser, so
yeah, true.
The electrolysis is that other equipment that Suzanne operates, and that's fabulous. A lot of patients do come in specifically because their skin color doesn't match up with the laser. The laser kind of likes opposition. It likes dark hair, light skin. Dark skin can be a little bit can be affected. So electrolysis does go hand in hand, and so what we can't do in a big spot or a big area with the laser, we do with the electrolysis. The other machine that we have to address hair under the arms is the mirror dry. So we get sweat removal and we get hair removal with the mirror dry.
And sometimes that's an issue with PCOS, the abundance of sweat and oil.
Yes.
So it definitely helps.
So those are all things that help out this syndrome. So I don't know if I have anything else to add there. I think we got a great demonstration of the new baby from Saitan, and we love her. She does a lot more things than that. Stay tuned as we talk about more things about what she does. But that brings us up for what are we doing next month? We're still in the end of summer. Yeah. I'm still in pink, and I had on my white for the last time on Monday. That Labor Day Monday. I'm of that old school where you can't wear white after Labor Day. But anyway.
I think next month is hair loss awareness or something.
No, it's breast cancer awareness.
Oh, it's breast cancer awareness.
So October is breast cancer awareness. So I might be in pink again next month. So please stay tuned. We always like to cover anything that is new and upcoming, and we do have, unfortunately, a lot of women that do come in for cancer within the Renaissance Center and within the surgical realm. But we will give homage to that month, and that's where we try to gauge our roundtables. And if you have any questions, please don't hesitate to contact us. Our direct line is 570-674-5555 for Age of Innocence, and we can get you spread out through the building. That's just an easy number to remember, and you can follow with any questions that you might have. We'll be happy to help you. And until next month, enjoy the remainder of summer till I think September the 22nd is the last day, technically.
We're getting all our heat now.
And yes. And we've had 90s, and now we're today in the upper 80s, very humid. And we will see you in October when we hit the fall and the changing of the leaves.
Yes.
So till then, everyone, take care and have a great month. Bye now.